Alright, so today what we're going to do is we're going to fit the athlete here for a number of different knee braces. We call these prophylactic knee braces primarily because they're for prevention, which is the term for prophylactic. So these can be for athletes that don't have knee injuries, and so we want to put these on to make sure that they don't get one. Or it could be immediately after an injury, they're coming back, they need a little bit extra protection. So it kind of depends on when you decide to put it on. So this particular situation, we're going to assume he doesn't have a knee injury, so we're just going to fit it. And the key with these is that the better you fit them, the more apt they're going to be to use them, because if they're uncomfortable, they're going to just throw them off and say, no, I don't want to use that at all. So it's a good idea for you to try putting it on yourself and run around a little bit. If you're like, no, that doesn't fit very well at all, I would never wear that, you can pretty much be guaranteed that the athlete's not going to. So so get very comfortable with how these actual braces work and how they feel. This particular one is designed, it's got one protective brace on the side. It's going to go, this brace here is going to go on the lateral side, so if they come in and collide, it's going to protect not only the LCL but primarily the MCL. Ideally you would think that this would go on the inside, but if it's on the inside then it's going to collide with his other knee and cause problems as he runs. So we really don't want that much on the inside. So this hard part here always goes on the lateral side. This brace is also designed to go either right or left, depending on where the screw is positioned. This is set up now for the left knee. If you wanted it for the right knee, you would switch the screw over and then just flip the thing the other direction. It's all ready to go. So you don't have to worry about two different braces. The way this brace is also designed is that you have a larger portion on the top and a narrower, shorter portion on the bottom. So you can always tell what's the top and what's the bottom. The longer portion is going to go around the thigh, and the shorter portion is going to go around the calf. This brace is also designed with another extra strap that goes on the inside right over the medial collateral ligament. So we got to fit this in here so his foot kind of goes in this loop. We get it roughly positioned right in the lateral joint line. Okay, so kind of right on the side here. You want him to be able to flex and extend without too much limitation. So we want to make sure that the strap comes around. I'm going to strap it down, Velcro. The tighter the better. He might, the only way that looser is better is for circulation, but if this thing flaps around and is too sloppy, there's no way the athlete's going to wear it. So generally speaking, I almost always go too tight first, let them try it out. If they say, it's cutting off the circulation, then I might consider thinking about loosening it up. Okay, so now I've got it strapped down, and I can see, well, I've kind of gone up a little bit too high. This should be right at the lateral joint line, so I kind of want to see where he's bending. So I'm like, okay, it's a little too high, so I'm just going to reposition and bring it down just a little bit. Secure it tight, and they're probably going to fit this themselves after the first couple of times. So, so you can tell them to readjust it as much as adjust it if need be. So this looks okay. You might want to turn it over just a little bit to get a little bit more on the lateral side, but you really want this whole bar to be right on the lateral side of the leg. This then strap comes just as on the bottom of the tibia and fibula. Just cranks that a little bit tighter so everything's secure, because the more this doesn't slide around, the more they're going to feel comfortable with it and be okay with it. Okay. So I'm going to move the camera here so you can see the inside, how this strap actually fits. this particular piece wants to go right over the medial collateral ligament. So kind of find the joint line, place that right there. Okay, then I'm going to pull these straps down as snug as I can get them, again where it's comfortable. These now pull tight. This is going to pull snug up here. Pull this tight underneath and make sure everything fits okay. Because what that's going to do is if he takes a blow here, that is going to provide a counterbalance and help provide and support this. Okay. Now you might look at it and go, I don't know if that fits well. Well, the key is for him to be able to get up and move around and see if he likes it. If he hates it, you say, you know, just let's try it for one practice, see if you can get used to it. If he comes back and says, no, it's just sliding down, it doesn't really feel like it's doing anything, then you want to try to go through and do some adjustments on it. But the more secure you can, the better. So I'll quick take this off. And there's a variety of other types of braces. Another type, this particular one here, which the main difference with this is that it's got hinges on both sides, both the right and the left hand side. Okay, but that being said, so that provides a little bit of lateral support. It's not as big and bulky, which is good, but it's not as supportive. But it is neoprene all the way around, so you are going to get some of the benefits of the neoprene sleeves as well as the brace as well. Okay? So this particular one, the way that it works is this is in the back of the knee, poplite heel space. So it goes, lays nice and flat. This comes around. Okay. Gets velcroed into place here. Okay. And what these straps do is they just tie down and pull this whole thing tight. Now you can see right here, just by doing that, it's trying to bunch up too much. So this particular brace is a little bit, it's going to be a little bit too big. Not only that, but it's missing one of the straps that it actually needs to be able to hold, hold these down right where it needs to be, because it's missing a little clip right here. So right away I know, you know what, that is not quite fitting right. It's too loose, it's too sloppy. As soon as he gets running, this is going to slide down and not do anything, supportive for him. So I'm going to go in and get a, smaller size, one that actually tightens up, but the straps, make sure that the straps are already all good to go, making sure that it works normally. So each brace that you get, you really just kind of have to look through the fitting guide, making sure that it accomplishes what you want to. There's different brands, there's different styles, there's just different sizes. So you just have to find the right one that fits for this particular athlete.